Alrighty, we've got a pretty good number of people, so I see people still rolling in, but we're going to go ahead and get started to respect everyone's time. So welcome again. My name's Katie Giza. For those of you who don't know, I'm the Continuum of Care Coordinator. We're really happy to have you here on this webinar today. Just a couple of logistics, which I know you guys are probably all very used to right now. So feel free to use the chat, type your questions in. Love for you to pop in and say hello even. This week has been a rough week, I think, for a lot of folks, just trying to process everything and just really seeing the realities of some of the disparities in our country come to light. And so I think if anyone has a good joke that they want to share with folks, I bet we could all use a good joke. So feel free to pop a joke in the chat, say hello in the chat. Just a friendly reminder, please keep yourself muted. Unless you have a question, you are welcome to unmute yourself to ask a question, but unless you are presenting or are directly asking a question, we do ask that you keep yourself muted to minimize background noise. If you accidentally unmute yourself, just a heads up that I will have to mute you. I'm not trying to be rude. I just want to keep the background noise minimal so we can all hear the presentation material. And then lastly, just thank you guys for all of your hard work. We're so grateful to be partnering with you guys. I can't think of a better team of people to be doing this work with. And so I'm grateful to be on the team with you guys and excited to continue to move this work forward. And then here is our agenda for today. So we're going to kind of have some of the same similar things that we see on these webinars. We'll have some shelter updates, fun. Additional thing, we're going to talk about the vaccine today, so that'll be great for folks to hear. And then we've got some system updates. We're going to have a little section about success stories, and then resources. We've got some resources to share with you guys. So without further ado, I'm going to turn it over to Lauren, I believe, to talk about our shelter updates.
Good morning, everybody. It's Lauren from the city of Detroit. Happy New Year to everybody as well. Just a couple quick shelter updates for today, since we want to focus a little bit more on the vaccine. This is my bi-weekly reminder of Code Blue, our severe weather policy. Sorry if you can hear my dog squeaking a toy in the background. Just a reminder that Code Blue is when temperatures hit below 20 degrees, including wind chill between the hours of 4 p.m. and 8 a.m. or freezing rain, ice storms of more than 6 inches of snow. And then state of emergency as well are examples of like the polar vortex, when we hit near record high or low temperatures declared by the city, state, or federal government. And just a reminder that during this time, we ask shelters to take everybody in, pull up a chair. We mobilize outreach teams to try to get folks off the streets and into shelters. So really, it's a system-wide effort to keep folks safe during these times. And you will receive an email from the city of Detroit saying when Code Blue is in effect and then when it is no longer in effect. And then just some alternative shelter data. We currently have 0 clients in type 1, which is just symptomatic. And then we have 53 positive clients in shelter type 2. And that is down from 59 clients the previous week. So great job, everyone. Oh, and then we're gonna turn it over to, it's either Dr. Rahman or Denise Fair from the health department for the vaccine update. So I'm not sure who's on right now.
I do believe I see Dr. Rahman on the call.
Yeah, I don't think Denise is on yet, so I can just start. So and then on the call as well from our team, I believe, well, Sheila Finch is on. She's our emergency preparedness coordinator or director, who's helped leading the response, and Vicki Wynn is our communications director. I don't think I see anybody else. But yeah, just to give you an update. So with these phases, we've already started vaccinating people, like healthcare professionals, and so the 100 MAC clinic where the health department is located has already started vaccinating a couple of weeks ago. We're now doing about 150 people per day, and we had received 2,000 doses of the Moderna vaccine. So it's a 2-dose. you do one dose and then 28 days later, you do the second one. We should be getting some Pfizer vaccines next week, hopefully. That's also a 2-dose series. So one you do at day 1, and then the second dose you do at 21 days. So our plan, if any of you saw the press conference where the mayor and Chief Fair talked, we are going to be expanding our phases as directed by the state. And so we're adding shelters, and so that would include any residents or staff. And our plan would be to start on Wednesday. We're still in the process of scheduling and everything, but we wanted to let you know that it is going to be an option. And we'll probably do one round and then come back for another one at a later time point, because everything's really dependent on when we'll get vaccine. And then we also will have the ability to do some education. I know that our outreach and education director, Yolanda Hill, had spoken, and it was a very well received presentation. So we'll make sure that we're providing the proper education, and then whatever reading material is available as well. I don't know if Sheila, do you have any updates from the vaccine side on availability and what you think is coming that we could be using for the shelters? And also to this community as well, we're going to be, the health department is going to be vaccinating at senior living facilities as well. So those are our 2 priority groups. I'm not sure if she might be on another call. But yeah, those are my basic updates. We're still in a planning phase. All of this has been going really fast, and so we've at least vaccinated, I believe, almost 1,000 people right now so far. And really the greatest side effect has been arm pain. It kind of feels like a tetanus shot. I received mine, Chief Fair received hers a couple of weeks ago. So we really, really strongly recommend it for everyone. We don't want people in the hospitals. We want to prevent as much as we can. And, this is, we really pushed for this with the state too, to bring the shelter population up top. And so this is one of our priorities from the health department side.
Dr. Rahman, you have a couple questions in the chat box, if I could just read them off to you. Yep. So the first question is from Ann Blake from Pope Francis Center. She said, where will vaccines be given out and how do we sign up?
So we'll come to the facilities. We're going to have outreach teams. So, and we'll figure out the scheduling component, because this is just new stuff from yesterday. Likely the quarantine team, Rachel Gibbs under management, Tierra Defoe, they will help lead with Sheila Finch and Dave Ya from the health department to schedule. But yeah, just stand by on that. But just keep your eye on your emails though, so that we can schedule. And then just to let you know, when we come out to vaccinate, we'll have teams of 3. So there will be a registered nurse or a physician or a nurse practitioner, and then there will be a medical assistant and then an advocate. So we'll need all 3 individuals. We'll need one to observe, because after you give the dose, you have to do observation for 15 minutes just to make sure nobody has any side effects. And then we'll also be entering all the doses into MICR, which is the state's registry for immunizations. So that's how we'll keep track. And then we'll also provide a print-off of everybody's immunizations records at the end of their session too, and then reschedule for the 21 or 28 days for follow-up.
All right, a couple more questions here. Do specific organizations need to do anything to get on the list scheduled, or will they be contacted directly?
We'll contact you directly.
Great. And then does this include outreach staff? So just a little background on this. We have street outreach staff who are seeing clients directly face to face. Does this include them as well, or are we just focusing on emergency?
Yeah, you see them on the meeting, you could have brought it to me.
I didn't think about that. So what we'll probably have to do is just get numbers. But yeah, I mean, I would not exclude anybody that is an essential worker.
And so
But
Oh, go ahead.
Question to that, sorry, just to add to that, would this also then, is there a plan to get unsheltered homeless populations, persons who are on the street and not staying in an emergency shelter?
Yeah, so that's something that we started thinking about, because there's maybe 1,100 that are sheltered and maybe another 1,000 that are unsheltered, if I'm correct. We're gonna be getting the Wayne State, like the street medicine team. I don't know if I haven't worked with them, but I was just advised that like they may be able to come out. So if we can, but that's gonna be a little more challenging because of like that second dose for follow-up, but we're not going to exclude. We just need to come up with like a really good strategy for that. So what I'm thinking right now is to start with like the shelters that are like sort of like low-hanging fruit where it's going to be easy for follow-up, like to start with them. And then like just having a couple of weeks to come up with a strategy with the ones where it may be a little bit more challenging to locate individuals. But we're going to try to get as many people as we can.
Great, thank you, Lauren. Reading the questions from the chat.
Oh, I'm sorry, I was muted there. Let's see. So the health department outreach team will go to shelters. Any sense of timing so that we can make sure all staff are in the building?
That's something else that we need to talk to each shelter about, because we know that it's better to go during the evening for some it doesn't matter if they're during the day. The plan is that we're going to do one shelter a day and then 2 senior facilities. So at least you guys will know that it'll only be one per day that will be prioritized. But yeah, we'll have to work out the schedule with each individual facility.
And then the next question is, where do permanent supportive housing frontline staff fall into prioritization? So I'm not sure if you're familiar with permanent supportive housing, but it's folks that are in their own apartments, but they do have direct contact with the clients, their staff does.
They seem to be in the priority group to me. Again, this is just, we're going to have to work the numbers out and then figure out how to get people vaccinated. And in that case, some of the staff may actually be able to get scheduled at the health department if it's easier. So I'll make sure that I talk to, I don't know if my other team members are on here, but.
Hey, Dr. Ramon. Hey.
Oh, Dave, yeah, jump in for any of this.
Yeah, I just heard the part about people going to those who are in permanent assisted housing. I don't know if that group gets consolidated within certain organizations, but we reached out to the 9 licensed home health agencies that have headquarters in Detroit. And schedule them for vaccination starting back in December. So if the kind of caretakers you're talking about are kind of members of this group, they may already be coming in. We've only done about 70 of them so far, only because I think interest by and large has been variable across agencies. But yes, we are vaccinating them at 100 MAC. I guess I'm hoping for clarification. Do like groups like Precise Home Healthcare or Crystal Home Health, are these the types of organizations that you're talking about?
Hi, Dave. This is Tara Linsner from Housing Revitalization. So no, those are different.
Okay.
So our PFH are typically homeless service providers that offer a different kind of program for individuals experiencing homelessness, a permanent supportive housing or rapid rehousing program. So they still do have face-to-face with clients, but they're different than the group of individuals you're talking about. So I think, and Dr. Armando we talked about this briefly late last night. So housing revitalization, and we're going to make sure that the Homeless Action Network of Detroit, which manages the PFH programs, we will definitely be connecting with the health department when it comes to vaccination planning to make sure that all of the different types of programs that have face-to-face contact with clients are included, so the staff will be included in this frontline workers, because you are working on the front lines. So we are definitely, I think we have some conversations planned either later today and then next week as well. So we'll definitely be looping those groups in so that none of the different program types are kind of left behind.
Thank you, Tara. Trying to see if there's any questions here that aren't. Anne says the city is distributing vaccines at the TECF Center beginning Monday to prioritize frontline workers. Do shelter employees fall into this category, and can we get vaccines there?
Is that a question for I can try to answer that, but Dr. Mon or if Denise
Yeah.
are on.
I don't know if I'll be able to answer that one.
I think in all of the planning discussions thus far, we want to make sure there's as many options as possible for all individuals. So even though, for example, we're going out to senior living facilities, et cetera, and other facilities for direct on-site administration, there's no reason that they couldn't also come over to one of the facilities that we're standing up for drive-through once they're open. That communication, the confirmation will come from the mayor's office as far as when we have the site set up, a confirmed start date, and which populations will be eligible kind of in which week. We do want to make it open to everybody, but I think they're trying to make sure they have good tracking for the populations where we are already planning to go out to the facilities, for example, the shelters, and who they're going to recruit to bring into the drive-throughs.
Thank you so much. And then just a planning question that we may also still need to plan for how shelter residents will get the second dose, considering they may or may not still be at the same shelter 20+ days following their first dose. So yes, Amanda, that's something that we definitely need to take into consideration.
Yep, and that's also something, hi everybody, this is Tara again. That's also something that I have been having conversations with the health department about, because we know that people will move in between shelters or they'll leave shelter and then come back. And so because of the transient nature of this population, there's additional planning that absolutely has to happen. And so we have already been starting to have those conversations. And again, we'll loop hand in as well to see if HMIS could potentially assist in that tracking. So there's a lot to come. Again, things have been moving really, really fast. And so we are definitely trying to keep up and do as much planning and preparation as possible in the event of this. But that is definitely something that is on our minds because we know that people just, a lot of people just don't stay there for 28 days. So we want to make sure that we're catching them for that second dose.
Hey, Tara, can I ask you a question real fast?
Sure. Yeah.
So in the planning that first of all, thank you for all your hard work on this. And then second, in the planning that you've been having with the health department, I know sometimes we use the word shelters synonymously with congregate facilities. So I just wanted to clarify here, are our congregate PSH facilities included in this kind of like first round of vaccines as well? Or is it only the shelters specifically this time?
We have like 5 or 6 PSH facilities. Rachel, if you could jump in and help with this part. I'm anticipating vaccinating whatever list we have, but I defer to my team.
Yeah, so there are a few programs that you guys have that do have PSH programs, transitional housing programs. So the ones that are connected to shelters, those will be tested as well. I'm sorry, those will be given the vaccine as well.
Just to rephrase that, the congregate PSH programs that are getting tested and part of that testing schedule with the shelters will also be included in that same list, will also be part of the vaccination schedule. Is that correct?
Yep, that's right.
Okay, thanks. So if you're a congregate PSH program and you have been getting the regular testing, either that has been happening through HANU, then you are part of this shelter group, this group that we've considered like this congregate homelessness programs. And so you will also have the vaccines rolled out at the same time as the shelters.
All right, I think that's all of our questions. So thank you to everyone at the health department for coming on and talking about this, and thank you everyone else for your wonderful questions.
Yeah, thank you, everyone. You'll be hearing a lot from us in the future. I know you've been communicating a lot more with Rachel Gibbs and Tara Defoe. So, you know, I just want to keep strengthening the relationship with all of you. So thank you.
Thank you so much. We really appreciate you guys coming on and updating on us on this. And we also appreciate your help to make sure that we can get our staff and our clients vaccinated. So this is an exciting opportunity. We're excited to continue to work this out and get more details moving forward.
There's actually like one question about educating staff and residents about the vaccine. So we'll try to do this like as best as possible, but just from our side, things are moving really, really fast just because we have to use the vaccine as quickly as possible. So at minimum, we'll send educational material. I know that that's not sufficient, but like we'll try to get on these calls more often as well, just so that as questions come up, you can ask them, or like if you've heard anything like in the media or in any reports, because there is a lot of information that's like coming out in the news that's like has no scientific evidence, and so we'll work on getting education out to all of you guys. But it's just like COVID testing and that rollout, things were moving so fast we couldn't even keep up. But I can confidently tell you that with the vaccine that we've done so far, we've only had arm soreness. We haven't had any adverse reactions with Moderna. So thanks.
Sorry, one more question. Thank you, by the way, for answering all these questions. In the chat, someone asked, in terms of timing, can shelters expect to hear from the health department between today and Monday, or what's the time frame they should really be making sure to look out for communication?
Shoot for Monday or Tuesday.
Monday or Tuesday. Perfect.
Yep.
Thank you.
Thanks.
All right, so with that, we are going to transition into some system updates. And so we've got just a couple of reminders and things we want for folks to keep on your radars. So Lauren mentioned, or someone mentioned earlier, the testing. We continue to have our ongoing testing for our shelters and congregate facilities. That I think we're trying to get folks tested roughly every 2 weeks right now. And so we've mentioned this a few times. We just want to make sure that all of our PSH providers, all of our project-based PSH providers know that if you want to get your clients in the testing rotation as well, then you can. And if you want to do this, please reach out to Lauren Licata to get that scheduled. We've had about two providers take advantage of this. So we just want to make sure that you guys know that this option is available in case you want to start utilizing it. And then we did also want to make sure it's on your radar that with the recent pass of the legislation in December to provide more coronavirus relief, there is a second round of economic impact payments. And so, or as we often call them, the stimulus checks. And so we just want to let you know to be kind of on the lookout to help clients to make sure that they get this second round of payments. If they received payments in the first round, then they should be able to receive the payment in the second round in the same manner without any problems. But we've put a link in here that if you want to just check into it and see where the payment is, you can use the Get My Payment tool, which I believe is the same one that we had for the first round of payments. But we just wanted this to be on your radar to kind of work with clients. Again, we know that it took some work with a number of our clients just to make sure that they got this money. And so we just want to make sure that we're helping them with this round too. And then we did want to just put a brief plug here. So I know a few months ago, Hand mentioned that we had some masks available, and we've gotten another donation, another generous donation, which we're very excited about, of both reusable and disposable masks. And so we've provided a link into the PowerPoint. And if I get a chance, I can also pop that link into the chat for folks. And so we've provided a link in the PowerPoint for you to request masks. We do have a lot, so feel free to request as many as you need, and we'll do our best to accommodate that. We would love for you to request masks, both for your staff and your clients. And so I think we're wanting to prioritize the reusable masks for clients specifically, so that they have masks that they can continue to use. And then we also do want to try to prioritize this for our housing projects, our transitional housing, rapid rehousing, and permanent supportive housing, as we know that the city helps provide a lot of masks and PPE for our congregate facilities. If you are a congregate facility and you do need masks, feel free to reach out and we'll do our best to accommodate everyone. We just did want to make the plug that we do want to prioritize this for our housing providers that don't always get in the rotation of PPE from other sources. And then this is a plug from the HMIS team. They just wanted to make sure that folks save February 18th to 19th. Mark it on your calendars for, there's going to be an HMIS boot camp coming up for our ESG CV projects. And this is all projects that receive ESG CV funding. The HMIS team, I believe, is going to reach out to you all directly with an email to give you more information on this. I think I did see William on here, so I just want to give a brief second in case William wanted to add any information.
For sure, yeah. Thank you so much for that, Katie. Yeah, so this is the save the date for the HMIS bootcamp for ESG CV projects. So as required, this is for emergency shelters, prevention, rapid rehousing, and so yeah, emergency shelters, prevention, street outreach, and rapid rehousing projects are required to attend. The reason for this, it is a 2-day boot camp to go over HMIS. And some people and some providers may already know the processes, but this is also a good opportunity to get up to date with certain things, maybe refresh your memories on some of the trainings that have happened in the past or anything like that, because we're going to be planning within the next month to go over what will be done in these boot camp sessions, and it'll be a 2-day session. So it'll be half the day for each day. So that's why I made it 2 days. So it don't take up all your day on those 2 days. And so we will be able to get more details out once we figure out what time the sessions will be and where we'll be going from there. So that's what we kind of wanted to do, save the date. So February 18th and 19th, please kind of see what you can do to not have so many meetings that day so we can get these boot camps done for your for teachings going forward.
Perfect. And then I did see Kiana pop a clarification in the chat. So I believe Kiana was saying, and Kiana, feel free to pop in. It's not just ESG CV funded projects that are required. I believe it's all ESG projects that are required. Is that correct, Kiana? Do you want to just provide a little clarity? You can unmute yourself.
Thank you. Yes, well, William is correct. It is ESG, CV, and ESG. In our continuum, a lot of our ESG providers are also receiving ESG CV, but we want to make sure that if there are some that do not receive CV, they are also part of the loop for ESG. But we will be in touch directly with invitations, as well as your City of Detroit contract managers. Once we loop them in with all of the details, they will too be sending out reminders and making sure that we have, invited all of the appropriate parties.
And then we had a question from Jean Griggs asking, is this for all staff or just the agency administrators?
It's mainly for the agency administrators, but if some staff would like to come in, we don't want to like say, no, you can't come in. It's like, no, if you want to come in to learn as well. So, because the agency administrators are the ones that are going to be taking this information back. But if some of the staff is able to come in, because we don't want to take people away from their work if they don't need to. So, but if some staff wants to come in, they're more than welcome to.
Yeah, so I encourage Jean, the way that you're structured at your agency, that if you have staff that can be available, especially for the detailed workflows, there is also, as William stated, there's going to be some specific trainings part of the boot camp that are targeted for agency admins and for like reporting and some of those pieces that staff may not, it may not benefit staff to attend, but as we lay out the choices, you'll be able to better determine, what your frontline staff might benefit from, and then obviously what you as the agency administrator and your other leadership staff, would benefit from.
Perfect. Thank you guys so much. I don't see any more questions in the chat, so thank you again. And then with that, we have a quick point in time count update. And so just a reminder to folks, we talked about this a couple of webinars ago. So this slide is from a couple webinars ago. So this update is specifically about the unsheltered point in time count. And so typically, historically, in the past, our unsheltered point in time count has included two components: the street count, which is on the day of the point in time count where teams go out and engage with unsheltered persons and complete a brief survey with them. And then also next day interviews, going to kind of common locations where unsheltered persons visit during the day, and trying to make sure that anyone who may have been missed in the count the night before is captured. And then that information is combined and deduplicated in order to ultimately submit to HUD. However, HUD released some guidance that allowed a number of allowances that COCs are welcome to take to modify their point in time count due to the coronavirus pandemic, just really wanting to make sure that communities prioritize safety, also recognizing just the additional burden that the pandemic has put onto staff, and wanting to be cognizant of that as well. And so the exceptions that they are allowing are all listed here. And so in December, HAND submitted an exception request to HUD to forego the unsheltered point in time count altogether. That exception request was granted by William Snow from HUD. We did just get notification from HUD yesterday that there is now a formal waiver process for it, similar to the process that that we've undergone for waivers to other program requirements in the CoC during the pandemic. And so we just got notification of that. So we plan to formally apply for the waiver in order to have that kind of logistically all documented. So I'll change the language of this on here. I did write this before we got the notification that we needed to do an additional step. So an exception request was granted, and we're going to officially apply for the waiver. And then even though we're foregoing the unsheltered count this year, we are still our street outreach teams are going to continue their excellent efforts to continue to engage folks, to link them to shelter and resources. And then there's also a valiant effort by the city of Detroit and our HMIS team and our outreach teams in order to clean up our data in HMIS around the unsheltered population, so that we can really have better look to HMIS to get an accurate count of how many people are experiencing unsheltered homelessness And then if anyone's interested, what's on the screen, these are just a lot of the things that the planning team considered whenever we decided to make the decision to apply for the full exception. And then we did just want to make sure that even though we are not doing the unsheltered point in time count this year, we wanted to make sure that folks recognize that we are still doing the sheltered point in time count and we are still doing our housing inventory chart. And so this will continue as normal. So just a couple of quick reminders to folks. The point in time count, the sheltered point in time count will occur on January 27th of this month. And then the HMIS team wanted folks to save the date on January 25th for a mandatory webinar. And so similar to the boot camp, we just encourage folks to look out for an email from the HMIS team for more information about what this, this webinar will entail. And then with that, I'm going to turn it over to Amanda to talk about some waivers.
Thank you. Good morning, everyone. This is Amanda. So yes, waivers seem to be the word of the day. So I'm going to make this pretty quick. For those of you who receive CoC funding, you did receive an email from me yesterday with some more details on this, but just want to make sure everyone is aware of this. So if you've been around since the spring, you'll know that HUD has been periodically issuing waivers, waiving certain regulatory requirements for CoC and ESG programs. And then as Katie alluded to, they're also waiving the regulatory requirement related to the unsheltered point in time count. So at the end of December, HUD issued a 4th round of waivers, extending waivers that had been set to expire at the end of December. So these, this latest extension applies only to CoC funded programs. There's nothing new. These are really just an extension of 7 already existing waivers. So I'm just going to briefly review kind of what the waivers were that were extended. If your agency has requested these waivers in the past, you do need to re-request them if you want to continue to have the opportunity to use them through the end of March. Again, the document that I sent yesterday gives more details on that. I know I've already heard from a few agencies that have requested the waivers, so thank you for that. Please do keep me kind of in the loop. If you request the waiver, it's just helpful for me to know. And as in the past, we use the term waiver request or apply for the waiver, but it's really letting HUD know that you intend to exercise the flexibility within the waiver. You have to let HUD know within 2 days that you might use the waiver kind of 2 days before you might use it. So there's not really like a formal approval process. It's more so you giving HUD a heads up that, you know, hey, I'm planning on possibly using this waiver flexibility. You can go to the next slide, please. So I'm going to quickly go through, again, kind of the ones that were extended. Again, these are not new, and we have talked about some of these in more detail at the Rapid Rehousing and the PSH work groups. And I do still have on my radar a request from providers that have been asked in terms of some additional kind of guidance or how to document the use of these waivers. So we'll look to see how we can provide that. But just real briefly, the waivers that have been extended through the end of March. So the third-party documentation of income. So this waives the requirement that you have third-party source documentation of income. If that is not able to be gained, you can't get that third-party documentation just because offices are closed or, you know, offices are really backlogged. You can use a client self-certification on the amount of income they anticipate to receive over the next 3 months. You can use that in lieu of third-party documentation. Another waiver that was extended was the HMIS requirement at initial move-in. So this waiver waives the requirement that a unit pass HQS inspection at the time of initial move-in. Really, this waiver is pretty broad in that it says you can not do an inspection at all, even like a remote inspection, as long as the owner of the unit certifies they have no reasonable basis to have knowledge that there's any life-threatening conditions in that unit, and that you have policies to physically inspect the unit within 3 months after the health crisis ends. So the one thing that we've said before about this requirement is this HQS requirement is that we absolutely do not want to put clients in housing that is substandard or that is not safe. And so really only use this waiver if doing so is absolutely necessary to get a client out of homelessness. But to the extent you are able to do those HQS inspections at initial move-in, if it's in person or if it's remote, using technology, obviously social distancing, all of that, that is really what we do want to see be done. Another thing, as we go through some of these waivers, one thing that another provider has pointed out to us is that if you place clients in units exercising some of these waivers, and if that client, say, gets pulled for a moving up voucher or HCV voucher, that is going to have the inspection, documentation requirements, you may be having to go back and redo some of this work anyway at that time. So to the greatest extent possible that you can still do the standard documentation, do the typical unit inspection process, please continue to do that. Again, these waivers are in place so that if we just can't move someone into housing because of barriers, these waivers are there to essentially get someone out of homelessness and into a unit if using the waiver will help facilitate that to happen. Sorry, that was sort of a side note. So the third waiver on the screen here that is still in place this third one applies only to rapid rehousing. And the current regulatory requirement is that you need to, for unit size, is that you need to have at least 1 bedroom or sleeping area for every 2 persons. So this waiver does waive that requirement. However, again, if you have people in rapid rehousing, just be mindful that they may get pulled for an HCV voucher, in which case that unit size requirement is going to kind of come back into play. So we certainly don't want to be setting someone up for a situation where they may actually have to physically move to another unit because HCV is going to have different unit size requirements than what this waiver would allow. So in general, still consider the kind of the standard requirements: 1 bedroom or living room, sleeping room for every 2 persons. You can go to the next slide. So again, this waiver, the first one on the screen here, applies just to rapid rehousing, and this is the monthly case management requirement. So this is the one that HUD has been sort of continually extending over the past year. So the regulations currently do require rapid rehousing participants to have at least monthly case management. So this waiver waives that regulatory requirement. And again, this waiver extends that out to the end of March. However, as we've been saying kind of all along, we still expect our rapid rehousing providers to continue to outreach and engage with their clients, whether that's virtually, over the phone, email, texting, what have you, if you can't do it in person. So to every extent possible, we still expect our rapid rehousing providers to be engaging with their clients. What this waiver does is essentially, if HUD is coming out to monitor you and it sees that you are, not meeting that regulatory requirement of monthly case management, and that you were not able to meet that requirement because of staffing capacity or other issues related to COVID, that would not, you would be exempt from that because you did request the waiver. But again, having this waiver does not by any means, mean that rapid rehousing clients should not continually to be engaged and reached out to. The last two, again, are extensions. The FMR requirements allows leasing projects to lease units that are above the FMR rate, so long as they meet rent reasonableness. Again, be kind of cautious with that, because if a client in that unit then does get pulled for an HCV voucher where an FMR requirement is going to come into place, you may have some snags. So just kind of be mindful with use of that one. And the last one is the initial 1-year lease agreement. the regulations right now do require clients in PSH and rapid rehousing to have an initial lease that's at least 1 year in duration. That requirement has been waived for leases that are signed kind of through March. If you can move someone into a unit, if moving a client into a unit would be better facilitated by having an initial lease agreement that is less than 1 year. That's what that waiver does allow. So again, with all of these waivers, just if you request the waiver, and that doesn't mean that you have to use it, I would just really encourage you to consider using it. You know, it is a tool that can be used if using it would help move that client into housing more quickly. That is really the purpose and the intent of the waivers. So these are the ones that have been extended through March. Other waivers that were not slated to expire at the end of December that are still active are still in place. So waivers related to disability documentation, the rapid rehousing assistance being able to be provided for more than 24 months, and some other waivers are still in place. They're still in effect. So all of these waivers that are now kind of extended through March will kind of be waiting to see what happens in the next few months, see how things look at, towards the end of March. We may be seeing further extensions on these waivers. It's really just a wait and see. So you may or may not be hearing from me with more information on waivers. But again, for CoC funded agencies, I did send an email out about this yesterday. So please just take a look at that and don't hesitate to reach out to me if you have further questions. All right, thank you.
Wonderful. Thank you, Amanda. We appreciate that. And so this next one is, we just wanted to put a plug here that we want to celebrate, we want to continue to stay in a habit of celebrating successes in the CoC. And we just wanted to open the floor up to you guys. If you have any success stories, any bragging you want to do on your agency, your team, then we would love to hear from you. We want to celebrate with you. And so we just wanted to kind of give a chance for that. So folks, if you're interested in sharing a success story at an upcoming webinar, I do think we have a minute or two now if anyone wanted to chime in, but also feel free to email myself or Lauren Licata at the City of Detroit and let us know that you have a success you want to celebrate, and we'll make sure to get you on the schedule for a future webinar so that we can celebrate that along with you. If anyone has anything they want to share now, this is right on the spot though, so I'll be quiet for just a second, just in case you want to join in. Otherwise, we can move on to the resources. We just wanted to make this plug so that you knew to be thinking about it and to reach out to us when you think of something. All right, not hearing anything. Then we're going to move into resources. Scott, I didn't know if you wanted to talk about this slide briefly.
Sure. Good morning, everyone. This is Scott with CAM. And we just wanted to share some upcoming training opportunities that we have that we're offering in partnership with the Detroit at Work, the workforce system, and Heartland Alliance, which is an agency out of Chicago that does technical assistance in this area. So we have a training coming up towards the end of the month on systems work better together. So how we can partner across systems to support folks experiencing homelessness in accessing employment. And then also coming up in February, we have a training on benefits counseling for folks who are seeking employment. So I'll pop the links in the chat as well if you're interested in attending those trainings, as well as we now have on our website a page with recordings from previous trainings, a lot of which we've advertised here before. So if you're interested in going back and looking at those, I'd welcome you to do so.
Wonderful, thank you. And then we did just want to put on your radar as well some upcoming state training opportunities. So there is an opportunity for the state ID waiver program. There's a training on January 11th from 1 p.m. to 3 p.m. The Michigan Coalition Against Homelessness is working to put this training on. And so we've got a registration in the slide. And if I get a second, I can pop it in the chat. I know Amanda did put the links to the slides in the chat. It may be easiest for folks to just click on that to get access to this. And then we've also, we're notified that there is a SOAR training. So if folks want to be certified as a SOAR practitioner in Michigan, there is a cohort of training that runs from February 1st to March 11th. I believe these are self-paced trainings. And the registration for that is open right now. So folks can register and then take those courses and then become certified. So that's an exciting opportunity. So we wanted to make sure that you were aware of that as well. And then we also just wanted to put on your radar a couple of national training opportunities. So NAEH, the National Alliance to End Homelessness, has developed a self-paced racial equity learning series. And so the purpose of this is to really kind of look at racial inequity in our nation, particularly in the context of housing and homelessness, and to also then not only look at the problem, but also think about solutions. And so this self-paced training series is available for anyone who's interested. I think it costs $35, which isn't too bad. And so the registration for that is also in the slide. And then NAEH is also, as many of you likely know, they hold annual trainings or annual conferences throughout the year. And so this year, their conference on ending homelessness is going to be virtual. And it's going to be in March this year, March 8th to March 10th. Each of those days, it's going to run from 12 p.m. to 6 p.m. And they don't have a registration link for this yet. So we just wanted to get this out there to you guys if you're interested in joining it. It's only a $50 registration. So it is much more accessible than it has been when you go to the in-person ones. And so those are the dates that it's running. Whenever we have the registration link, we're happy to share that with you, but they just haven't released that yet. They just, I think, sent a save the date out so folks would put it on their calendars. And then I did see Jessica gave a helpful clarification in the chat about the SOAR training. So it is self-paced for most of it, but there is at the end a group training session that folks will do before they get certified. So that is wonderful to know. And if there's any other updates or things that folks have, we do have a couple minutes. Otherwise, we can let you go with 5 extra minutes in your day. All right, not seeing anything from folks or hearing anything, then thank you all so much for coming today. Thank you for all your excellent questions and for your engagement and for all the work that you guys continue to do. I hope you have a wonderful weekend. I hope you get some time to recharge, and we will see you again in 2 weeks. Thank you guys.